Guam Department of Education, Jon Fernandez. Good morning, Jon. Thanks for joining us for Standing Wednesday.
Off a day, everybody. Happy Wednesday.
Let's just go ahead and get right into it. I think one of the things that we've been talking about, well, since yesterday, was this letter from a group called United for Education. Jon, did you get eyes on the letter and read it?
Sure. I did, yeah. I mean, I'm not familiar with the organization, if it's an organization or something that's newly formed, but I did review it. And the questions that they proffered were largely related to the effectiveness and background on the vaccines that have been authorized for COVID-19. So I responded that, these sound like questions that, we can try to answer, and I will ask public health as the healthcare, authority to see if they can provide answers to the vaccine. So, I think this employee mandate issued by the governor, that's been out since early August. I think or August 6th was when 2021-17 was issued, which required a mandate for all government of Guam employees to be vaccinated by September 24th or to submit to weekly testing. I guess I'd say I'm proud to report that 99% of our employees are compliant with that requirement. That means probably around 92% are fully vaccinated, and the remaining 7% have indicated or have already submitted to weekly testing. So I think in large part, employees have, reviewed the requirement, have made determinations about whether they feel comfortable with the vaccine. And for those who do not feel comfortable with the vaccine, then they submit to weekly testing or go and apply for an exemption from Department of Administration for either medical or religious purposes. So, I think we've done our best to put that information out, let people know what's coming. In fact, we didn't implement it, the week of the 24th. We actually delayed implementation to make sure that we had everything we needed in place to make sure that things went smoothly. So far, I think, I know the letter that you're indicating, but as far as the reports from the schools, I believe we have maybe about 4 employees who are, basically have refused vaccination and refused to submit to testing. But other than that, everybody else, seems to be, choosing one or the other option.
What happened to the 4 employees?
Well, as you know, there are 2 critical documents relative to implementation, right? One is the executive order issued by the governor under her Organic Act powers. And then the second is the DOE guidance, the circular, which of course has been submitted to all employees for their information as well. In that circular, I think similar to the tuberculosis vaccination requirements, if you do not receive that, then you are to not to report to the work site, and you will be placed on annual leave. And if that leave is exhausted, you will then be on leave without pay. So that's the status of those 4 employees. Actually, I think it's only 3 employees who had to return home. One has presented a medical exemption, approved by DOE from both vaccination and testing, and that's that is one thing we're trying to clarify because that's we just were presented with that. But as far as the other 3, they continue to be at home until such time as they come into compliance. And that's, and we're talking about 3,500 employees as well. So, like I said, we have a vast majority, almost 100%, or over 99% who have chosen one of the other options. And so for the most part, we're not seeing the same level of concern or issue at all schools, except to say that, of course, there are those who are concerned about the vaccine, and the executive order doesn't require that you get the vaccination. If you don't, you have to submit to weekly testing. And so that's really, those are the options that are presented to the employees.
So have you responded to them in writing, or are you leaving that to public health?
My response to them was that we would take those questions about the vaccine, which again, for many people, I think those questions have existed since the vaccines first started to, come onto the scene and get emergency approval and so forth. So, unfortunately, those questions are coming kind of late in the game, but we're happy to go try to get a response. But those are the same questions I'm sure people have been asking for the past, year since the vaccines first started or first getting approved. So we'll work with public health because I don't want to give any inaccurate or out of date information. But having questions about the vaccine might impact your decision whether or not to go forward to get the vaccination, or might impact your decision about what vaccine to take. But if, while you're making that decision, the requirement to test weekly is still in place. So the questions that were presented really didn't ask anything about the testing requirement. It was really focused on the vaccines that are authorized. And so, I think public health should, continue to provide information to the general public about the safety and effectiveness of the vaccines as far as they, understand. And we know that, the CDC and other health organizations continue to put out updated information based on studies being conducted, during the time period of this pandemic. So I will, again, work with Director St. Augustine to see if we can answer those questions. But again, let's be clear that doesn't exempt you from weekly testing. And as far as my review of the letter goes, that was addressed to me. Then I think I didn't see any concerns or questions raised about the testing requirement. It was really focused on the safety and effectiveness of the vaccination. I did see the audience to whom the letter was addressed or sent by email. And I just want to note, this is being implemented at the very highest level. So, this is coming from an executive order from the governor. It's being implemented by public health and Department of Administration. And unfortunately, they weren't included in the email. So I would always suggest that, raise those concerns as well to to the highest authority that is really making the determinations and decisions. I'm happy to pass it on. But again, these decisions are being issued based on the advice the governor is receiving, and probably based on the examples that you can see across the country. Numerous states and private sector companies have done the same thing in terms of implementing a vaccination requirements for all their employees. I mean, ranging from states like Colorado, Nevada, Connecticut, to companies like Amazon and Walmart. I mean, I think you span the entire range of different organizations that have looked at this issue and have decided how they want to approach it. But it's not something brand new for Guam. I think it is something that we've seen in other places. And in fact, I think the Supreme Court has taken 3 recent stances on the issue by refusing to overturn mandates of the University of Indiana, New York City Public Schools, and recently the Maine mandate requiring their frontline healthcare workers to be vaccinated.
Yeah, I noticed that too when I was looking at who was CC'd on the letter, and I didn't see the governor on here or public health when the mandate came from them. Have you received any correspondence or any concerns then from parents as you move to implement again the governor's mandate for the random testing of students?
Well, yes, we definitely have received questions and concerns about that, and I've informed those parents that once we put together a plan and a proposed approach for student testing, we will definitely share that with them. That time frame is closer to the time frame for being able to present the plan will probably be closer to mid-November at the earliest, and that's because we're basically taking the opportunity to implement the employee testing, which is a requirement and which is at a smaller scale. And we're looking at the logistics, we're looking at the supply needed and so forth to be able to inform our thinking about what would be a larger, operation to try to find a way to randomly test 26 to 2,700 students. So we're not there yet. I mean, we understand what the directive is and what the goal is to achieve at least a 10% random testing of students. But we're given until January under the executive order and under the public health guidance, given until January to try to attain that goal. So as we go through this first week of employee testing, as we review, get feedback, look at how it's operating, look at all the issues that we need to address, and then we will shift gears and take a look at how we might approach the student testing directive after we've got our feel comfortable with the logistics of the employee testing.
So it's not going to lead to a shortage of teachers. We're talking about 4 employees here in the whole. How many employees total?
Oh, yeah, correct. We have 2 employees. We have 3 employees who are at home, and another employee who I think was at Agana Heights, who actually is on campus because the employee did receive the appropriate exemption. Now we are going to continue to consult with GDOE as we see these cases, and these objections come to come to the schools. But at this point, based on my update from Human Resources, that's where we're at. Otherwise, we're tracking 99% of our employees who have chosen one or the other option. I think 92% was the latest percentage of fully vaccinated employees at the schools, and then the remainder of the 7% or so are actually opting to go through the weekly testing requirement. We received, I believe, in total a total number of 6 approved exemptions from testing from DOA so far. So again, for those who are seeking exemptions, the process is to go to DOA to receive the medical exemptions. And I believe there's a process that goes through Department of Public Health for religious exemptions. And so we're aware of a pending religious exemption request. So we're in communication with Public Health to try to see if they are, if a decision on that is imminent, so we can then, respond to that employee. And then the 6 that have been approved are medical exemptions received by employees. So I did hear a concern about getting a medical exemption, but not being willing to submit it to DOA or Public Health because of a disagreement with the process. I think that's that's up to the employee to determine how they want to comply with the requirements. But otherwise, we do know that 6 employees have already received their exemptions from DOA.
Did anyone get an exemption that you know of, like one of these, beliefs, or so there's medical, what's the other one? Is it just religious?
The other one's religious, right? I do know that it is important to have an opportunity for those who have religious objections to register and seek an exemption. And I understand that I'm aware because of an employee, bringing it to our attention, because they do apply directly to the agency. So we are aware of one pending religious request for exemption on religious grounds, and then we're waiting to see what the response is from the appropriate agency. So Department of Education is not reviewing and approving these exemptions. These are taking place at Department of Administration and Department of Public Health. So if you ask us about whether or not this exemption is approved, we're going to have to check in with the appropriate agency that is authorized to issue those decisions. And so that's what we're doing. When we hear about the exemption, we say, let's just confirm that with the relevant agency, because even if the employee has not received a response yet, we don't want to take action unless we've verified and hopefully we can confirm that a response is imminent and that employee can be notified, and we can also be notified of all the approved exemption requests.
Okay. Bree, anything else?
Yeah, I wanted to follow up on, as you guys transition to expanding the testing to students. I think in a previous interview you mentioned something about test kits, and the ones that you have are going to expire and they're going to have to transition to a different test kit.
So we get all of our test kits from Department of Public Health. Those test kits have gone through, I mean, they provide understanding they do expire in November. I believe they've gone through an extension of that date, so November is the extended date. But once we get through November, my understanding is that they will have to move to another test. And it's my recollection. I mean, it's my understanding that the procurement is underway for a new test. And it was. I don't want to determine what say what the final decision is, because it might be changing. But what I'm hopeful for is that I understand that they were looking at a test that I believe is a salival test. And so we do have a lot of parents and employees who also indicated with their concerns for testing that they would prefer, if there was an opportunity to take a test that was less invasive than the test they're familiar with. And I just want to clarify, right? We're talking about several tests that are on the market right now. The tests that that I've been through, gone to my private medical provider, and I've gone through I've gone through the public testing at the Northern Public Health site with those PCR tests. Those have the extra long Q-tips, right? So those ones I know and I understand. I said, boy, that's not the best feeling, but I've been through that a couple of times and gone through it in the interest of trying to make sure I can determine whether or not COVID-19 I might be a possible positive. But the ones that we're administering right now, the Abbott Binex Now, actually is a test that can be self-administered. So our nurses and employees who are trained are really, working with the employees. The employee self-administers the test, meaning they're the ones who place it in their nostril, their nasal, the lower nasal area. They're the ones who return it to our employees, who then put the swab into the appropriate, part of the kit for the necessary reaction. When we go to the salival test, now it's going to be a swab inside the mouth, and we'll have to be trained on how that's supposed to be done, and how long and how many times you need to swab. But again, that seems like it would be even less invasive. So we have heard from parents and employees who said, hey, you know what, if you go to that, we're not going to have a problem. We'll be fine. Just let us know when that's coming. So our understanding is that if that's the case and the salival tests are what's being procured, that by the time we get through November, the salival test will be the test that we need to, transition to. And hopefully, as we design, the approach for expanded testing, that'll bring some comfort level to those who want to participate in the test but are worried about, the type of test that is going to be administered. And let me just remind everybody that I don't foresee a student testing approach that does not first require the consent of the child or the parent, if the child is a minor, before a test is administered. Actually, right now with the employee testing, they actually have to sign a consent form before we test, because it's important to ensure that they understand that it's voluntary, and if not, they can choose other options under the executive order, whether it's to vaccinate or not. So I think that's the other concern about the testing. I think I think you might have heard already that the FDA, an FDA panel has already endorsed a vaccine for the under 12-year-olds. So I think that's something that's kind of breaking news today. And of course, following that FDA endorsement, that'll have to go through the process to obtain, I guess, official CDC approval in order for that to be available. But it's our understanding that, public health is gearing up for the possibility of the vaccines for the I don't know if it's 5 to 11, but that's what I'm hearing, at least the 5 to 11-year-olds, the under 12-year-olds, to be available, shortly. And if that's the case, then that presents an opportunity for all of our elementary school families who've been worried that a vaccine is not available for their child to take advantage of that opportunity when it comes to Guam. So we're going to stay monitoring those, that news and that development, because that's been a critical, concern for parents who are, evaluating the face-to-face option for students. Middle school and high school has been less of those concerns. I mean, there are some concerns about, the number of students on campus and so forth, but the elementary school families, a lot of them have just said, look, the older students can get the vaccine. None of that's available as an option for for our kids. So we are, going to be more anxious and more concerned at the elementary level. So hopefully the vaccine being available will help those families who opt to take advantage of that opportunity.
Well, thank you, John. We're good, Raver. You good?
Yes, thanks, John.
Thank you so much, John.
Is there
Appreciate
anything
it.
else you wanted to
how
get
about
on?
you? Want to wish everyone a happy Halloween?
Well, like I said, a lot of attention being brought to the testing going on this week, but there's so much else going on with the Department of Education. So we'll hope to continue, talking to your reporters at KOM and others about the continued work on our state strategic plan, on our facilities efforts, and looking at what's happening in the classroom. We really want to get our students back to face-to-face instruction. So as we do the testing, as we look at this vaccination for younger kids, we're also monitoring, the healthcare situation. It's good to see that even though numbers are still in the high range, that the overall trend is showing a decline in cases that we will hopefully see continue in the next couple of weeks to get down out of that high risk level. So we aren't where we were, a month or two ago. Things are, relatively trending in the right direction, but we're not out of the woods yet. But I want everyone to know that the minute we have a chance to consider bringing kids back, especially maybe the older students, we're going to want to discuss that and decide on that time frame. A lot has been discussed about learning loss, and I think that you also have heard my response, which is hard to address learning loss when the kids can't come back to school. Mm-hmm. So our core strategy is get the kids back in the classroom with their teachers, and then support them with interventions around that core instruction. Otherwise, it's going to be very difficult. It might sound nice, but it's going to be very difficult to address learning loss while learning loss is still occurring, right? So you can't get your kids back 5 days a week. It's like trying to bandage a cut while you're bleeding from some other part of your body. You have to stem the bleeding and then cure the situation. So we're working on that, and again, it just means that the community has to get into a better position in terms of our overall community health.
Thanks a lot, John.
Thank you, John.
All right, thanks everyone.
Okay.
Have a great week.
Okay, you too, my friend. 8:58, Tomas Manglotnia.
But before we get to
Okay.
that, we